and Children. She will also be receiving a national award tomorrow. Please welcome Ms. Alima Nasir.
Thank you very much, Madam Chairperson. Honorable Prime Minister Samuel Hines, Ministers of the Government, Foreign Affairs Ms. Carmen Rodriguez, Amerindian Affairs Ms. Pauline Sukai, Ms. Gail Teixeira, Ambassadors, Chief of Missions and members of the Diplomatic Corps, Dr. Suleiman Brahimo, Country Representative of UNICEF Guyana and Suriname, representatives of other organizations from the donor community, representatives of the interrelated agencies pertaining to birth registration in Guyana, the Director of Public Prosecution, Ms. Shalimar Ali Haq, leaders of the religious communities, representatives of human rights, the indigenous people, the ethnic relations and women and gender equality commissions, members and Chief Executive Officer of the Rights of the Child Commission, and all other distinguished guests. Firstly, it would be remiss of me not to seize this opportunity to publicly thank UNICEF for its unwavering support that it has afforded the Rights of the Child Commission as we strive to move forward to truly represent our constitutional mandate. The strong technical and other support garnered from UNICEF had gone a long way in facilitating the achievement of some of the rights of the child's key deliverables in 2011. Thank you very much, UNICEF, and we look forward to your continued support in the years ahead. Distinguished guests, please allow me to briefly highlight some significant points which endorses the necessity of birth registration. Rhetorically, the question of why, as one of your first activities, the Rights of the Child Commission has decided to undertake an investigative approach to birth registration, as opposed to focusing on some other existing issues related to child rights. Let me openly admit that the Rights of the Child Commission is cognizant of the fact that the issues affecting children are many and that we are currently developing strategic approaches aimed at tackling them cross-sectionally. But why this focal interest in birth registration now? Birth registration is the cornerstone of all child rights. Birth registration is the first proof of legal identity. Birth registration represents the starting point for the recognition and protection of every child's fundamental right to identity and existence. It refers to the permanent and official recording of a child's existence by some administrative levels of the state that is normally coordinated by a specific branch of the government. Children whose births are unregistered may not be able to claim the services and protection due to them on a full and equal basis as with other children. Birth registration is essential in preventing child labor. Birth registration is necessary if we are to ensure that children in conflict with the law are not treated legally and practically as adults. Birth registration enables our efforts to reduce trafficking. Birth registration will allow for children to get a passport, conduct various legitimate transactions, and to vote. Birth registration is crucial in the implementation of national policies and legislation, establishing minimum ages for work, recruitment, and marriage. During emergencies, birth registration provides a basis for locating separated and unaccompanied children. Birth registration is even more vital for establishing such rights as inheritance. This is certainly not the entire list, but I'm sure that the picture has been painted. Further, distinguished guests, the human rights of children are most concisely and fully articulated in one international human rights treaty, the Convention on the Rights of the Child. The Convention is the most widely ratified human rights instrument in history. And a key concept of the CRC is that children, as individuals, have rights. And these must be enumerated, legally binding, and made specific, evolving development of the child. Article 7 of the Convention on the Rights of the Child, 1989, calls for the registration of a child immediately after birth. Drawing from the right to a name and nationality contained in this Article 7, the 2002 General Assembly Resolution, A World Fit for Children, reaffirms government's commitment to ensure the birth registration of all children and to invest in education and protect children from harm and exploitation. In order to achieve these goals, it is necessary for governments to have accurate population data so as to plan services provision for children and their caregivers. We simply cannot ignore the far-reaching consequences that can result from a child not being registered. Birth registration is a critical first step in safeguarding a child's rights throughout life. Perhaps this resounding point was best put in simple terms by Archbishop Desmond Tutu at the launching Plan's Universal Birth Registration Campaign in February 2005, when he highlighted the importance of a birth certificate, the proof of birth registration, and I quote, "It is a small paper, but it actually establishes who you are and gives access to the rights and the privileges and the obligations of citizenship." I thank you all for coming and affording the Rights of the Child Commission the opportunity to add its voice for the call of universal birth registration by 2011. And it gave me great pleasure to announce that immediately after this function, we're heading over to the State House. President Jack Deo is going to sign on to the declaration to have all children registered by the year 2015. I thank you.
Thank you, Alima. I will now call on Ms. Esther McIntosh, the lead consultant, and she will give us an overview of the report and the key findings. Please welcome her. Thank you very much. Distinguished guests, ladies and gentlemen, I'm going to make a very brief presentation this morning on the findings of the report. The title of my presentation is the same as the final report, which will be available shortly. Birth rightly generated through the fieldwork and engagement in the field. Great. So just to give you a brief outline, I'll just provide a very short background as well as a very short synopsis of the methodology that we use, and then present the research findings, which I've classified under these three headings: practice, prevalence, and for the sake of alliteration, policy, but policy actually includes legislation as well. So the goal of the study was to assess factors that promote and challenge the rights of children to an identity. And there were a number of questions that were included in the initial TOR and also in the inception report, but essentially these are the two main questions. What is the current situation, and also where do we stand in terms of achieving universal birth registration in Guyana? And this has greatly influenced the methodology also that we used for the study. So the approach was essentially a qualitative research approach, and we engaged various stakeholders, key stakeholders, including persons who were involved in birth registration in Guyana. One limitation of the study, though, was that we were unable to have meetings with the GRO, which is the primary agency under the Ministry of Home Affairs that is responsible for birth registration. We used purposive sampling to determine the 4 regions in which the study was done, and then random sampling to identify the communities in which we worked. So these are the 4 regions that we were selected on the map, regions 1, 2, 7, and 10. We worked in 12 communities, 618 households were engaged, and we covered within those 618 households 1,770 children. And just to say very briefly that we within the community level, the regional level, we did a household survey, so that sort of is the one quantitative component of the research. But because we wanted to have a very sort of future-looking planning element to the report, we also included a capacity assessment which examined things like human resources, infrastructure, and so on within the regions that would allow for universal birth registration. So to get into the first component, which is the policy element, there is, as Alima mentioned, a very strong and comprehensive international framework which includes the Bill of Human Rights and more recently the Convention on the Rights of the Child, which is perhaps the most comprehensive. So the Bill of Human Rights has one important covenant, which is the Covenant on Economic, Social and Cultural Rights. And this requires that states not discriminate against children who do not have a birth certificate in order to access an education. And consistent with that, Guyana allows children to enter schools irrespective of whether they have a birth certificate or not. I think one of the most exciting things that's happening right now in terms of birth registration coverage is the emphasis that's being placed on it by CARICOM. The CARICOM framework for action for children also includes a specific target, which is to ensure universal birth registration in all member states. And therefore, I think the timing of this research and also of the efforts to achieve birth registration is key, because it will feed into a broader effort to ensure birth registration in the region. And the local framework in Guyana is basically premised on these 3 key documents: Guyana's Constitution and the Citizenship Act, which guarantees a child, or guarantees the provision for children to access their rights to an identity. And the most key act in that regard is the Registration of Births and Deaths Act. And just to examine that, so the registration process, as outlined in the original act, falls under the Ministry of Home Affairs, and to the right is the process that has changed somewhat over time. Initially, the primary act allowed for 21 days for notification, and then quite a long period for the registration of a child, 30 and 60 days. 60 days were allowed for communities that lived in sort of remote areas. They call them second schedule communities. And this has now changed over time. It went to 21 days for the entire process, and currently it's 14 days that are allowed for birth registration. There's a grace period if you don't register, where you can provide information and affidavit and so on, and your child can still be registered. But after the 1-year phase, that's considered late registration, and it is a bit more lengthy in terms of what is required of someone who is registered late. Yeah. So, as I think most of you are aware, there has been a plethora of acts that have been issued in recent years that speak directly to children, and some of them are highlighted here, including the Adoption Act, which specifically mentions birth registration, the Protection of Children Act, etc. There's also the Criminal Offences Act, and the act that established the Child Protection Agency. So what we generally found is that what is happening in practice is that it doesn't, the current act which was enacted in 1973, doesn't reflect current legislation like the Adoption Act, which specifically requires the establishment of an adoption register, and these are not necessarily reflected in the current act, as well as some of the practices which I'll highlight later on. And there's also an increased number of agencies like the Ministry of Amerindian Affairs that are now involved and very key to the birth registration process in hinterland communities, but this is not reflected in the current act. And many of the new acts that I mentioned previously are premised on the ability of children to identify that they are who they are. But what we found, and that data comes up a bit later on, is that 44% of the children who were living in homes, and this is from a survey that the Ministry of Human Services had done earlier this year, are unregistered. So really, orphans and vulnerable children are a core group that needs to be considered when we are looking at birth registrations. And the last 2 points on this slide refer mainly to those requirements under the CRC, which is that a child be given a name and that birth registration is made free for children. Yeah, so I'll probably reiterate this to go through this quickly. The current legal framework does provide a strong basis because of the three key documents, the Constitution, including the Constitution and the Act, but it does fall short in a few key areas. And the policies in Guyana on birth registration are slightly weak. For example, the old PRS document specifically talks about decentralization of birth registration, of the birth registration process, and they identify the regional democratic councils as being the primary agencies to do that. This hasn't occurred, but it also is not, as the study will show, it is not necessarily the key agency that we would recommend for birth registration. And several of the other policy documents don't expressly mention birth registration, but it's subsumed under other sort of social issues. So this is one of the sort of best practices that are included in the document. In 2010, UNICEF, which I should mention is an agency that's been involved in birth registration for more than 60 years, developed a very strong report on best practices in birth registration. And several of the requirements that they suggest, for example, placing registrars in health institutions and decentralizing or increasing access to birth registration services through health offices, all of these have now become sort of common practice in Guyana, and this is more or less consistent throughout the country. So in terms of the prevalence and the rates that the data that we were able to generate at the household level, what we found was that birth registration rates are high. The study found 91%, but there have also been other studies that have been done. For example, in 2006, the mix also found high registration rates. One of the things that is also very key is that there has been a sort of a bringing down of some of the borders in terms of like where you live. So increasingly what we found was that irrespective of if you're in a hinterland area or in an urban or a rural center, you still have very strong access to services because of the placement of health workers, the use of community development offices under the Ministry of Amerindian Affairs and Tushaus to ensure the registration of both children and adults. So the high registration rates were recorded in hinterland areas, and we also looked at dimensions like poverty and education, but we didn't really find a correlation between high rates of poverty and registration or low rates of education and registration. So essentially, poor persons want the same things for their children. They are registering their children, and 55% of the persons who we surveyed were in the very low income bracket, which was less than $30,000 a month, and they recorded high rates of registration. And again, there's some evidence from the study that was done by the Ministry of Human Services that this may not be the case for orphans and vulnerable children, and this is specifically based on the data that we got from 22 homes. So we found that the majority of persons who were registered were children, and that persons, and I think this is also very good in terms of accomplishment for Guyana, that most of the children who were registered, 63%, are less than a year old. So it tends to suggest that they have registered their children within that window of registration, which is either 14 days and then under a year. And we didn't see a significant gender disparity. The urban and rural areas recorded high rates of registration, in fact the highest, but as you see there, Region 7 remains, and Region 1 remains quite high, above 80% and higher than 96% for Region 7. And one of the questions that we asked, which was a sort of a qualitative question, but we asked persons whether they thought that birth registration was important, and overwhelmingly they said yes. And one of the things I think that was the most notable, and I guess this is a credit to the nurses and those in the health profession, is that everybody referred to the 14 days. The older generation tended to report to 21 days, but they had a very strong understanding of what the process is and what they're required to do. Okay, so what does a non-registered child look like? I mean, most of the non-registered children tend to be older, and you'll see these brackets in the report, between the ages of 1 to 5 or 6 to 11. And if you can go down past. Yeah, so Region 1 and Region 7 had the highest number of non-registered children, and the graph on the right is just to show a bit of the difference within the region. So this is Region 1. So the three communities we surveyed there: Whitewater, Hobodai, and Hosororo. In Hosororo, even though Whitewater is the closest community to the center, they recorded the highest rate of non-registration. Okay, so this was a bit of data that we got very late on, but I thought it was very important to include it in the report because it is very telling in terms of children who, as Alima mentioned, are going through the system. So the ministry did a rapid survey of 22 homes. They surveyed 711 children in 4 regions and found that the majority of them are registered, but a significant number of them, 44%, were not registered. So it sort of speaks to the importance of directly targeting those vulnerable groups. So what are some of the challenges that we face in Guyana? One is definitely the flow of information and the ability to track birth registration records throughout the system. So, for example, we met many people, especially in the hinterland communities, who would say, in the presence of the CDO or the Tushao, that I applied for it, my birth certificate, and sort of alluding to the fact that they had made a mistake or something. But in fact, the Tushao, the CDO, the community health worker has no way of telling where the application is within the process. So there's an inability to track that, and that is significant because essentially what people do is they will apply multiple times. So the next time somebody else comes to the community, they would apply again. Efficiency is another key area. Right now in Guyana, I think you can get a passport in 7 days. In 1 week you have a passport. And even though generally the birth registration, the rate of getting it back to you is quite high, it's still higher than the passport process. So I think we should try to equate those two. Centralization is actually recommended in one of the Caribbean studies that was done by PAHO, but I think that this has not strengthened the ability of the service to become more efficient. And also linkages amongst key agencies. We found that at the national level and also at the regional level, when we had focus groups there was not a lot of engagement across the agencies formally. A lot of it was personality driven or relationship driven, but most agencies said that they understood why it was, they understood that it was important for there to be greater coordination of efforts, also because most of the work of the Ministry of Health, Ministry of Armed Affairs, etc. are so closely interlinked. And this was just a quick diagram that I had done to sort of clarify the process in my own mind. The boxes that are in the darker shade in blue are those that are reflected in the app, and if you see the ones in the lighter shade gray, these are the ones that are sort of new and that have through the process of registration evolved and are now part of the birth registration process, some more so than others. So all the key documents that firstly state a child's right to a name, which is not reflected now in the current Registration Act, an identity and a nationality, and that I think it's timely for the Act to be reviewed and to be redrawn to reflect what is happening now in Guyana. Birth registration, I think the recommendation from the UN and other agencies should be free. And I should also say in terms of practice that the Ministry of Armed Affairs does in practice do that, because they make the payments at the head office level so that there is no cost to families in the region. But it is just a practice that they've adopted, it's not standard. I think one of the key things is that clear that there's a need for a strategic plan or a planning process in which key agencies like GRO can review their role, as well as the partnerships and the working relationships with other entities, and to look at things like incentives for registrars, the use of technology, and what the system actually requires in terms of personnel. There are very interesting developments in other third world countries where they're using public-private partnerships to have to make completely computerize the process. So they have these handheld instruments that you can be somewhere in Camarang or in the Pacaraima Mountains, hopefully with a signal, and you'll be able to enter the data. So it reduces this whole process of rushing to get the paper documents on a boat, on a plane, in a car to the ministry's office. And sort of not consistent with what was in the PAHO 2001 report for the Caribbean is that in my opinion, the system would be improved if it were decentralized. And the Ministry of Health in particular, I think, more so than the regional democratic councils, has a great role to play and is very strategically placed to provide birth certificates at the point of entry, as it were. I mean, when the baby is born at the hospital. And that's it. Thank you very much.
In Kathmandu, Nepal, Dr. Brima has worked in several key positions over the years, including Chief of Program Planning, Monitoring and Evaluation of the Nigeria Country Program at UNICEF, Head of the Division of United Nations Development Program Office, and State Program Monitoring Advisor in Edo State, Nigeria, Program Sociologist and later Program Training Manager with Louis Berger Development Program Consulting and Capacity Building Team of Paris, France. Dr. Brima is a national of Nigeria. In 1979, he earned a Bachelor of Science degree in Sociology and Anthropology from the University of Benin City, Nigeria. In 1983, he earned a Master's of Science degree in Sociology, followed in 1985 by a PhD in Sociology from the University of Wisconsin-Madison, United States of America. Please let's welcome Dr. Suleiman Brima.
Thank you very much, Madam Chair. The Children's Rights Commission and other bodies and groups that have been associated with this study for a very, very wonderful job. The challenge has been made clear now. What we need to do is to move forward. The recommendations are important, we need to implement them. And I commit fully to ensuring that UNICEF plays its own role in actualizing these recommendations. And we commit to doing that with effect from today. Thank you very much.
Thank you very much. My cabinet colleagues, ministers of foreign affairs, Amerindian affairs, and the advisor to the president on governance, members of the diplomatic corps, and especially the resident rep of UNICEF, our chairperson and members of the Rights of the Child Commission, ladies and gentlemen. Our president is at this time much busier than usual. He wanted very much to be here, but there are many things he's attending to at this time, so he's asked me to come and sit in for him. As has been said by the chairperson of the Rights of the Child Commission, he's arranged that immediately after this lunch and this ceremony here, the Rights of the Child Commission are invited to be at State House, where he will sign the declaration at 2:40 p.m. The government of Guyana has, from its inception in 1992, been concerned about children and children's rights. This has been evident in the poverty reduction programs that we implemented, and government's focus on the poor and vulnerable, in particular women, children, Amerindians, the elderly, and the disabled in difficult circumstances. Amongst programs we have implemented, we can note nutritional supplements to expectant mothers and then to children through the primary health care centers in the 1990s, and such programs continue on to today. There has been focus on immunization of children, and a high rate has been achieved. There is almost universal enrollment in primary education, thereby meeting one of our Millennium Development Goals. We've been assisting those in difficult circumstances with the provision of school uniforms or school uniform allowances from nursery to secondary schools. We've had a focus on construction of nursery and primary schools, particularly in the hinterlands, in Amerindian communities, but also all across Guyana. We've had, as mentioned before, 6 major pieces of progressive and modern legislation introduced and passed in Parliament and enacted to protect children's rights. We've had the construction of a family court, and we are awaiting the rules of the court being amended or interpreted so that the family court can get into action. We have had the establishment of the Child Care Protection Agency as an agency totally dedicated to the protection and promotion of children's rights and well-being. We've had constitutional reform that brought in human rights provisions for children and provided for children's interests. And I think the Rights of the Child Commission is evidence of that, or was resulted from that. And Guyana is acceding to the 2 optional protocols of the Convention of the Rights of the Child in regards to children in armed conflict and children and pornography and prostitution. This regional survey that is being launched today will certainly provide the government with data on the level of birth registration of children and move us closer to achieving universal birth registration by 2015. We are pleased that Guyana, in terms of regional comparison of birth registration, has fared well, coming in at 93%, and in the survey of the 4 regions and the sample of 618 households, we achieved 92% in that grouping. We also note that the survey found no disparities in the levels of birth registration as a result of gender. We know that in some countries the gender ratio has been affected by social considerations. Although there were interregional disparities due to a number of variables, this latter is a challenge and a focus for the government to ensure that there is equitable access to services throughout Guyana. Perhaps not unexpectedly, and as mentioned, the highest number of unregistered children were found in regions 1 and 7, and it will certainly focus programs, it will focus programs to raise the registration in those locations. The recommendations that have been made as a result of the survey, particularly those that would simplify the process and make it easier for children to be registered, will be given active consideration as soon as we get through the current election season and the new, hopefully the PDPC is back in government with a new mandate. As has been mentioned, the President will be signing the declaration committing Guyana to reaching universal birth registration by 2015, and will do so at 2:40 this afternoon at State House. I'd like to mention here our programs of 1 laptop per family and our general focus on IT or ICT, and certainly this will give the laying the basis for e-government, and soon, early along that road, I expect registration would be included.
A copy of the executive summary available at the front of the room for your viewing pleasure. Ladies and gentlemen, I announce lunch. Have a good day.
But I wanted to make sure that you understand how important this is for us. It's going to be a big part of our manifesto, focusing on children. So that's a prominent part of the manifesto, and elderly children continue to be a priority for the government. That manifesto will be launched on Saturday. So you're going to have the full support of the new government. And speakers too. Yeah. That's how I have to speak in a partisan way. But you will have the full support of the new government, because it's a commitment that we don't take lightly. We have to build, we've just been putting the building blocks together. You are the essential part of that infrastructure. But I think we are there's a lot more that needs to be done in the sector. From the enforcement perspective, training, even outlook programs. We're also looking at a lot of family-friendly policies. I don't want to talk much more about it because our candidate will do so, but ways and means of strengthening the family. And hopefully if we can strengthen the family, then children will have someone which will be nurtured. So this is really important. So how did it? Our numbers still are a bit low with the registration. It's higher than quite a few countries, and it's a respectable number. But where did we find in the survey the biggest gaps? Region 1 and 7, was it in the barometer area? Because barometer has always been a difficult area for us in inoculations and vaccinations and also access. So for the first time now, we just completed a road that will give us road access to that community. And a lot of we have issues in the schools and the language and everything else, largely because of its relative isolation. So when I looked at the numbers in the past for vaccinations, I found that there are a couple of communities, Guyana, and some others, that it's extraordinarily high because of access issues, and they have to go around, like in this case with vaccines, they have to float around these small refrigerators. So those distort a lot of the numbers in region 1 because they're so high in those communities, and those are pretty large communities. Barometer has over 1,000 people. Really? But then that is something that we have to examine, because if you could get kids registered from the outlying areas, why can't you? Is it the failing of the system? Is it failing of individuals? Do we have, the system should be able to identify this and correct it. If we have a properly functioning system, so we have to probably do a lot of work on this. We have made some real serious dedicated efforts, and sometimes people are very bureaucratic. I shouldn't say that, because these agencies, they insist on following every rule that has been set in place. So we found that several times in these communities, the people don't know even, they don't have a date for when the kids were born. And sometimes, especially if they're not registered on time. So then after that, it becomes a huge problem for the GL to register them.
What we found is that in some cases, the actual practice on the ground, what is really being done by the government is a lot more than what the law says to do. So, I mean, the efforts are a lot more than what the ordinarily expect. So, I think talking about situations where we are thinking about formally making sure that the rules were really on those three forces.
Yes.
It wasn't being done. I really think it's a very good thing that can deal with that.
But communities, hinterland communities particularly, have a peculiar situation. What was the split on the coast versus hinterland in terms of the gaps?
Normally what happens is that the hinterland generally between particularly the main communities and difficulty with pay are lower than the part of the market that Guyana has done very well.
Then if you have 97 on the coast and 84 in the interior, to come down overall to 94, it means the weight of the interior is pretty high. So it can't be just like Armenian, those communities that we know. I'm sorry I'm going through this now, but I just want to...
It's very concentrated on, these are just samples that were taken on those particular 4 regions.
So it's a sample base.
Yes, sample base of 4 regions.
So you just extrapolate it?
Exactly.
Oh, okay, I thought it was an actual survey of
No,
house. So there is, and what's the margin of error?
I mean, I'm talking about 5%.
Plus a 5 million, then that you could have 100% error. Oh, so it's just a
Think about it about
sample. I wasn't aware of that. I thought you had like a real survey, like a census along that.
No, think about it as an explorative study, an institution where we didn't have the full picture. So let's start to dig at what the picture looks like, and then let's start
Yeah,
to
because sample size matters too. Like I know when they did the poverty map for Guyana, and they look at 10 persons from region 1. You can't judge on a sample size of 10 persons. You know, you have so many factors that you have to adjust. So what was the sample size like in region 1?
I can't give you the exact sample size. The total sample size was like 1,600.
How many?
1,800. And it's about making sure that the issues that need to be looked at to ensure that when we move to the next step, where we increase the level of accuracy, and we start talking about universalism, we have a fundamental basis.
But if we're ranking countries based on the percentage, what was the sample survey in other countries? Was it similar percentage-wise?
It was similar.
No, I don't mean the results. I mean the sample size here. Because, you know, you have to have some uniformity in the survey to... So this is auspicious work, good work, and I think you're off to a propitious start. But if there is anything that we can do to help with this work and any other program, you should tell us. Even now, we do have a little bit of resources because there is blocked votes. So you may be able to even now get support for some of the other programs that we're working. I tell Roger so that we could have a discussion, maybe we can go and see. So what's the next frontier? Not on this issue. On this issue, I agree you can speak to the other leaders, but okay. Manifestos too, okay, alright. I mean, the AFC may not want to do it. I've been criticizing them for changing their manifesto after every public meeting. And so they've changed it 3 times. I don't see any reason why they shouldn't change it for the 4th time.
I think it's very important, and I'm very happy that the Excellency mentioned policy partners committing to children's issues. And I think it's a very good under the leadership of the Child Rights Commission. If all political parties made the same commitment, I think that would be very good to Guyana.
Yeah, exactly. We would have, that's not a partisan issue for us. So we would, if there's anything we can do to get all of the parties to come together and go before they
Who won that commitment before?
All right, yeah. Well, thank you very much. Work program-wise, what is it that you like that was there?
Yes, we announced that, yes.
But is there anything specific that you would like to achieve coming out of that? like some priorities.
Tony, hinder anything that you
Like if he handed it over to them, sign and
want to handle But then they should take steps. Once they come in, yes, once they come in, they should take steps to get the child, give the child an identity.
Absolutely, yes, they will be working with the competences home. Absolutely, they have like multiple children. Or the they usually at least around 180 students need to be addressed. And what happens is you get confident of when mother might not be able to tell you when you go on. So those are the challenges.
Yeah, but each child usually has their kids.